Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and this is just a hypothetical conversation, but someone asked me this. So let's say an orthodontist refers you a case. Let's say you're a general dentist, primary care dentist, a pediatric dentist. Someone refers you some case of yours for some icon treatment or some decalcification treatment. Clearly got little outlines of the brackets, like doo doo doo, little squares. Um, just had the braces taken off. What should you say? And this is your patient, keep in mind. This is your primary care patient. Did the orthodontist do this patient dirty, or did the patient do the orthodontist dirty? And what is your responsibility in this triangle? Okay, this is a triangle. This is patient and patient's mom on one apex of it, the primary care dentist, you, the referring dentist who is responsible for the patient's oral health, and the orthodontist who is responsible for straightening the teeth, but also making sure that healthy teeth don't get damaged in the process of straightening. So let's go over whose responsibility is whose. And I like to do this. I love ChatGPT. You guys, if you haven't, and I'm using this just as a term, I don't care if you use Grok or whatever, but it's really great. I'm not saying this is the Bible. I'm saying if you're not sure what society thinks or what common knowledge is, and that's something I've realized. I am neurodivergent. So a lot of times, like what's common sense and what's common knowledge and what's commonplace isn't common to me. My brain works very differently. So sometimes I have to dumb it down in chat GPT what common people think. I'm not talking about laws. I know what laws are and I know what best practices for dentistry. I'm talking about like common sense, what people think. Okay, so let's talk about this, okay? Because if your patients ask this question, they might ask it a little differently. And I asked it in like 3 different ways and I got the same answers. So you should know what now patients can get lots of information out there and they can get litigious a lot quicker. That's what I'm getting at. So you guys should know what's right and what's not. Okay. So, white spots or decalcifications or WSLs. I never called it a WSL, but I will now. Says they're common complications. I would not say they're common complications. I would say they were common complications a couple decades ago when braces were the only option. Now I would say they're uncommon complications and unfortunate complications that are unnecessary. Typically resulting from plaque accumulation and subsequent demineralization of the enamel. Yes, because the patients didn't clean. It says everyone's involved. Like I said, the patient and parent are all involved. The primary care dentists are involved, and the orthodontist to try to work on hygiene and um, make sure to be diligent about the oral hygiene practices, brushing, flossing, limiting sugary and acidic foods. Okay, blah 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 blah. Okay, so basically, everyone's responsible. It's everyone's job. It's not just one person's job, is what it comes down to. So, um, it says the dentists need to communicate with the patient and the parent about what's expected, and as needed, they may have to collaborate or, discontinue treatment. So anyone can make the decision to discontinue, is what I'm getting at. Ultimately, the orthodontist can make the decision to discontinue. If usually I'll give 1, 2, 3 warnings, and it's gonna be in the paperwork at the beginning, but I mean the warnings are gonna be very obvious. And we're gonna have a first time is gonna be light and fun, second time is gonna be more serious, third time mom's gonna realize that how it's going to work for them financially and for the kid down the road. Like, okay, we had an agreement, but the agreement has been broken. And it's very difficult when you honestly, as a parent of teenagers, um, soon to be one young adult, he's almost 20, I can't believe, no longer a teenager, but one 16-year-old, I, I mean, yeah, I mean, it's hard being a parent, and unless you've been the parent of teenagers, and you have to be teenagers plural because if you just have one kid, there's something about an only kid. They're just not the same. When you have multiple kids, they start acting like quote unquote normal teenagers, and they're just things going on in their brains and their hormones. Their brains just don't work right. Okay, so you can't. We have this conversation all the time in our house. Like my husband's always expecting like my daughter to answer like an adult, and sometimes she what does well beyond her years, and sometimes she responds to things like a doctor would. I mean, it's insane her brain sometimes, but sometimes she responds like an 8-year-old, like a actual 8-year-old. Sometimes we as adults respond like 8-year-olds. So, anyways, okay, you get the idea. So basically, what it comes down to is, yeah, I mean, these don't happen in a week, a day, a month. These happen in months, many months. So, I mean, either this is going to be kind of so hygiene for a long period of time and it was just very slow and oops we didn't notice it, and that's more of a, I mean, that's something that the orthodontist would have seen the plaque on the teeth at every visit. It's not getting cleaned off. I mean, I can tell, if it's new plaque, old plaque by looking at the gums. I can look at the gum line. If they just like brushed right before they came in and got it all off. But the fact of the matter is if they did that, that tells me they know how to brush it off. And there's really no excuse, and then I'll just mess with them. So, there's really no excuse, okay? I know when you're cheating. I know when you're not cheating. I know all that. And so after a few times, I'm going to start getting super serious. I'm not going to let this keep going on because it's my license as the orthodontist. Potentially, if it keeps happening, if the vast majority of my patients are having this happening, it is my license because it's only a matter of time before enough parents complain to a dental board, enough parents complain to an insurance company, or even your own staff. Trust me, your own staff knows when you're nasty, and they know when you're just trying to get more revenue. They know. They know what motivates you. And if you're more revenue focused and less patient focused, they are either going to leave, or they're going to start figuring what's in it for me. They're not going to be trusting you. And trust me, if they live in the community, people are full on asking. If you're not seeing every single one of your staff members, friends, family members, kids, I'm not talking about just getting discounts. They should be coming to you even if they're not getting discounts, even if they're an insurance patient. They should be coming to you. If they're not all coming, then you have a culture issue, and you can't force them to bring people, but that should tell you that there's something about you they don't like. And that is the issue. Your practice isn't growing, and that's how you know. So anyways, I went off on quite a big tangent, but there's a lot of information you should know about that. So, all right, thanks so much.